Inside the hospital road is part of the contract. But from Sewa town or from the major road to this place is supposed to be done by government. We are working very hard to see how best we can get those things done. And then power, electricity. Then we're talking to the energy minister. We're looking for some extra money to be able to do that one. I believe it won't take long. All these client obligations will be executed and we can come and commission this facility.
That is Health Minister Kwaku Agyemang-Manu during a visit to the newly constructed Ashanti Regional Hospital at Sewia in August 2022. 8 months on, the facility is yet to be put into use because government has failed to honor its client-related obligations. The fully equipped hospital at Sewia will be the third biggest health facility in the region, next to Komfanoche Teaching Hospital and the yet to be completed 500-bed military hospital at Afari.
The arrangements to bring in a contractor to do 8 hospitals, including this one, started from President Kufuor's time. Sewa has had its own challenges after President Kufuor exited.
For 25 years, residents of Ashanti Region, especially indigents of Sewia, whose lands were taken for the project, had hoped to see the completion of the hospital. Several promises from the government to operationalize the facility remained a mirage. Sewia Jasihine, Nana Safo Echampong speaks for the frustrated residents.
Regional hospital we are messing we are for no. A house here, a very woman penny for pencil. I bet Miss Abrino. I did 25 good years. O man penny for a ye bikoy. You were a tames, a ye bikoy. You were a mamma, as you be so moon. And an uncle for to so be so moon. Ready as Abri, Aka at the war. So we are my cousin Hyania Yabois. A high and papa acquire Dagene.
Construction of an indoor substation for the hospital began on January 14, 2023. When completed, the 20 kVA power station will serve the hospital as well as some communities in the Bosomtwe district. Contractors of the power station, Luton Engineering Services, hope to complete civil works in June 2023. But when will the hospital be ready to serve patients when there are no signs of work on the access roads?
The regional hospital at Sewua is completed. We are left with access road to the facility and dedicated electricity and water supply. It is hoped that the regional hospital project will be inaugurated during the 4th quarter of the year 2023. We are also progressing steadily at Adansi North District Hospital at Fomena and Sechele Kumawu District Hospital. It is expected that these 2 hospital projects will be completed by the end of 2023.
The 500-bed military hospital at Afari and the 120-bed facilities at Fomena and Kumawu have all suffered similar occupation challenges after the installation of medical equipment. Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaji, could not give definite timelines on the operationalization of those hospitals.
We are hoping that once the trainings and all the deployment for the new facilities are opened, the pressure will come down, the cases will be distributed more.
The completion of these facilities will augment existing health facilities, improve care delivery, and also increase access to quality health care. Residents are, however, cautiously optimistic on how soon these facilities will be put to use.
It's worrying to see such a facility waste away when the residents are in need of such a facility. It will be joy to see that facility being opened to us, because can you imagine in the middle of the night you have to trek all the way to, let's say, Atonsu or go back to Pramso. The road itself is not that good.
There's not even a sign of something going on there. As a resident, you need to travel all the way to Atonsu Agogo before you can have access health facility. And this is uncalled for. And we all know that facilities, when you leave facility unattended, it go bad.
That cannot waste away. There's a lot of money, a lot of investment that you've made. Why go through all this just to sit there and let it rot away? Can't rot away. People are dying. People travel miles and miles to get to hospitals, whilst they can travel a couple of meters just to get to the hospital that you have built for that purpose. There are no road networks, steady power. To me, we, the citizens, have to get up.
Perhaps the completion of the 507-bed capacity Konfanochi Maternity and Children's Block, which started in February 2021, following the demolition of a 44-year-old building over structural integrity issues, will put an icing on the cake. From Kumasi, for Joy News, Ohimintiria reporting.